Welcome to the GutFit Revolution podcast, the show where we dive deep into the world of gut health, nutrition, and fitness to help you unlock your best self from the inside out. I'm your host, Leigh Merotto, a registered dietitian, gut health expert, long-distance runner, and movement enthusiast on a mission to empower you with science-backed, whole-body strategies to fuel your body, heal your gut, and thrive in your active life. Whether you're here to finally break free from IBS and digestive symptoms, optimize your fitness performance, or learn how to support your gut health with natural strategies, you're in the right place. Each week, we'll explore topics like conquering digestive symptoms, building a gut-friendly lifestyle, enhancing endurance and strength performance, and more. So grab a cup of your favorite gut-friendly tea and settle in, because we're about to get gut fit together. Hello, everyone, and welcome to the first episode on the GutFit Revolution podcast. So what better to kick off the first episode and this podcast with an episode all about gut health. So the purpose of today's episode is really to dive into what gut health is so that we're all on the same page. I know it's a really trendy topic these days. Everyone's talking about gut health, from your grandmother to your dental hygienist to your neighbor next door. And it's just become such a popular topic, but probably most of you don't know how to accurately or fully explain what good gut health really is. So we're going to dive through some of the basics today, really get into it. I know some of you listening may be dealing with gut health specific conditions like IBS, GERD, IBD, SIBO, or just generally dealing with different gut health symptoms and maybe wondering why and how that applies to your health and maybe how it's impacting your entire body. So let's really get into it so that we're all on the same page and we're really understanding what gut health actually is. So let's get into it. So what is the gut? So the gut is also known as the GI, or the gastrointestinal tract, which is essentially a series of organs joined in a tube all the way from your mouth, which we know is where we start the digestive process. We have teeth in our mouth that grind down food. We have enzymes that come out when we start salivating and put food into our mouth. And then food travels its way through our esophagus and it makes its way into our stomach, where it usually stays for a period of time, less so if there's maybe foods that are less protein, fat, or fiber dense. And then maybe we'll move through quicker with foods that are a little bit lighter, like vegetables or just liquids. Then food moves into our small intestine, also known as our small bowel, and digestion starts to occur there, as well as absorption of different types of vitamins and minerals. And then the food makes its way into our large bowel, or our large intestine, continues to work its way through the gut. In the large bowel is where we have absorption of a lot of electrolytes as well as water. And then our large bowel is also an extra special place because it's where most of our gut microbiome is housed. So we have different microbes throughout our gut, but the majority of our gut microbiome is in our large bowel. Food makes its way through this tract and then it is excreted. Obviously, the end of the gut is known as the anus, and food makes its way out in the form of food or stool. So this whole tract is known as the gut, or the GI tract, all the way from the mouth to the other end. And outside of this, we have to give some praise and attention to some of our accessory digestive organs, including our liver, which is like our body's master detoxifier, detoxifies anything from medications to alcohol to different toxins in your food. Pancreas, which is important for secreting important digestive enzymes, and then our gallbladder, which houses bile, which is a substance that's produced by the liver but helps us to break down fat, and as well as absorption of different fat soluble nutrients. And these are outside of our digestive organ or our main gut, but they still play a role in the digestive system. So really, how do we define a healthy gut? We always hear we want to have a healthy gut. This is good for your gut health, but how do we define a healthy gut? So there isn't one specific standard definition that all researchers, all doctors essentially agree on. However, there are a series of different characteristics that we can use to sort of help us to come to the conclusion that you may have a healthy gut. So the first one is your microbiome. So as I mentioned, the gut microbiome is essentially the collection of different microbial species and their genetic material that are housed in your gut, and majority of them are in your large bowel or your large intestine. So we don't know exactly how to quantify or give values to different types of species of the microbes in our gut and how much exactly is a healthy gut. But we know that a really diverse microbiome, so a huge wide variety of different types of microbes, including mostly bacteria, but we also have different types of yeast and fungi and protozoa in our microbiome. Having lots of different species is essentially considered to be a healthy microbiome. What we don't want is a very limited variety. We want lots of variety of microbes in our gut because they do play actually different roles in our health, production of nutrients, absorption, immunity, etc. We can also define a healthy gut by general absence of gastrointestinal symptoms. So these are things like painful bloating, a lot of abdominal pain, discomfort, diarrhea, so sort of irregular stools, reflux, and nausea. Good to say, like there is some time and place for these symptoms. It's not normal to 100% of the time have no digestive symptoms. Sometimes these things can occur. We may eat something off or sleep a little bit less and they can sort of arise. But if these are things that you're dealing with on a regular basis, then there is a sign that there's some work to be done with the health of your gut. Absence of a disease, so inflammatory bowel disease, which we can see in a colonoscopy, colon cancer, of course, diverticulosis. So generally, we would define a healthy gut as being, absence of these diseases, or if you're someone who has dealt with these or is dealing with these, then, maybe putting it into remission and seeing a lot of the symptoms and the sort of characteristics of it within different investigations decrease over time. And then we can also define a healthy gut by having a strong intestinal wall. So the intestine, both our large and our small bowel, is really important for, like I said, absorption of water and different nutrients, vitamins, and minerals. And we really want that intestinal wall to be very strong. So ideally, not any permeability or sort of like a breakdown in the mucus layer, the intestinal epithelium that can sometimes allow maybe things from within the gut to travel into the bloodstream. We want it to be very strong and no permeability, and also an absence of any low-grade inflammation in the gut. If we do see, potentially low-grade inflammation, then that's a sign that potentially the microbiome has gone off track, maybe dysbiosis, or there's something going on. So these are sort of general characteristics that we would use to define whether you do have a healthy gut, some of them based on symptoms, others based on tests and investigations as well. Or maybe signs of a healthy gut, things that we can think of as well. So in terms of your bowel routine and your movements, ideally having daily healthy bowel movements is a sign of a healthy gut. We currently define healthy bowel routine as anywhere from 3 times a week to 3 times a day. For myself, as a registered dietitian working in gut health, working with IBS, I like to see people, work up to ideally having daily healthy bowel movements. Bowel movements are a way that we detoxify, we get rid of, excess toxins, cholesterol, all those things. So I like to see people eliminating their bowels at least once a day, up to around 3 times a day. Also, a normal level of bloating and distension after eating. So it is normal for our abdominal tract to maybe expand, a little bit and then go down between meals when we do have some, production of gas and fermentation within the intestine. That's a sign that our gut microbes are working to break down fiber and different fermentable foods, and a sign that things are working and that there's movement in there. So it is normal to have, a little bit of bloating, distension between meals and during the daytime. And, it's not going to stay exactly the same girth throughout the day. A little bit of normal bloating and distension. Also, mild wind. So gas is actually a normal thing. It's a sign that there's movement and there's digestion going on. So having some, toots and farts during the day is totally normal with minimal discomfort. Approximately 5 to 15 times a day is considered normal. And then absence of, that reflux, heartburn, indigestion, or nausea before, during, or after meals. Maybe, like I said, once in a while, once in a blue moon, maybe you go out and you have a rich meal and a couple drinks, and, may happen that you have some reflux. But if this is something that's happening every day, even a couple times a week, reflux, indigestion, nausea, that's a sign that something is off. And then maybe there's some tweaking to be done with the health of your gut and the microbiome, inflammation, and, potentially different dietary lifestyle factors that we want to adjust ideally to make those symptoms non-existent, because they generally aren't a sign of normal digestion. Like I said, some wind, a little bit of change in distension in your abdomen is normal, but having reflux, heartburn, and indigestion, quite those uncomfortable symptoms, generally not considered normal, and maybe a sign that gut health needs some health. So we can't talk about the gut without, looking at the whole body. It is really true when we say that gut health is your whole body health. We know now that the gut microbiome and that population of microbes within your gut, which is estimated actually to be a 1-to-1 ratio of microbes to human cells in the human body, which is crazy, they actually impact so much more than just your digestion or just what's localized to that area where the microbiome is housed. They really do impact your whole body health. So there are other indicators, that we may look for or think of when it comes to good gut health. So one of them, of course, is stable high energy levels. That may give us a sign that digestion is working, you're moving things through. We know when we're having good daily bowel movements and good motility that our energy levels are generally good. If you've ever been constipated for a couple days, that may make you feel a bit sluggish. Also a good sign that you're digesting nutrients properly, and you're having limited nutrient deficiencies too. An additional indicator is balanced mood and mental health. So we know that the population of microbes can impact the gut brain connection. And those with conditions like anxiety, depression often have a change in the types of microbes within their gut. So even having a healthy gut microbiome can help you to have a more balanced mood. There's always more to the picture, but definitely plays a big role. Even clear skin. So we know acne, eczema, psoriasis, those can be connected to the microbiome within the gut, and also translocation to your skin microbiome. Balanced hormone levels. So the gut microbiome plays a role in even production and regulation of hormones like estrogen, as well as insulin and blood sugar regulators. So definitely plays a role there. Immunity. So most of our immune system is housed in our gut microbiome. So if we've got a strong, resilient population in there, that actually helps us to prevent from getting sick and even conditions like cancer, etc. And then good recovery from your workouts and training. So these may be applicable to different conditions, but they are good indicators to, show that your gut health is strong and things are working in there. So diving into it a little bit more, I sort of teased about the gut microbiome, but really what is it? So the gut microbiome essentially is the collection of microorganisms within your gut. So mostly bacteria, but also little microbes, tiny organisms known as protozoa, as well as fungi like our yeast and archaea. So the gut bacteria, as well as the yeast too, do play important roles. So things like stimulating the immune system. We know that they may stimulate an immune response in response to an invader or a toxin, and get things moving so that your body can help to fight that infection or that virus. Break down toxic compounds. That's another important role of your gut bacteria. Synthesize vitamins. We know there's certain gut bacteria that help synthesize B vitamins and vitamin K. And then also, as I mentioned, even supporting mental health, as well as the production and regulation of neurotransmitters like serotonin, which we know consider our happy hormone. It does do a lot more, regulating circadian rhythms, etc. But about 90% of serotonin is actually produced in the gut. So it's a really important modulator for mental health. So really, our microbiome is thought to be our most important predictor of gut health. So most microbes generally are symbiotic, which means that they have benefits for both the health and the body. However, some are considered to be pathogenic, so they may be disease promoting. Most of the time, these microbes do live in harmony, but sometimes they can be disrupted due to different factors known as dysbiosis, or sort of imbalance in the gut microbiome. Maybe things have gone off track. There's too much of the bad bacteria and not enough of the good. So the sort of dysbiosis. And really, what is a healthy gut microbiome? So each person has a unique gut microbiome. We know it's dependent on our DNA, our genetics, as well as individual factors as we go throughout life. So different things throughout our life can modulate or change our microbiome. Of course, our diet, we know that, high fiber, high unsaturated fat, lots of plants in the diet, lots of diversity of real foods can help to strengthen the diversity of the microbiome. And conversely, Western diet where there's maybe a higher emphasis on saturated fats, those fats from animal products, higher protein and low fiber intake, that can lead to sort of a weakening of the resilience of the gut microbiome and a decrease in diversity. Stress, of course, different medications, even different diseases, conditions you experience, pollution, and then different things that may impact the microbiome more locally, different toxins like alcohol, even NSAIDs, etc. So really supporting a diverse gut microbiome is key to help keep our gut as well as, like I said, our whole body healthy. So let's get into it a little bit more, but really, what are healthy bowel movements? So I mentioned the frequency a little bit, and this can be a really great way to just sort of get an assessment of our gut health. It's not the only thing. I've had patients with IBS who maybe actually have normal stool, but then are still experiencing a lot of bloating and visceral hypersensitivity. So it's maybe not be the only thing, but it's generally a pretty good indicator of how things are working in the gut. So what is a healthy bowel movement? So typically we use something called the Bristol stool chart to assess different types of bowel movements. So typically type 3 to 4, which is considered between, sort of type 3 is like a sausage shape with cracks on the surface, to type 4 is more like a smooth, soft sausage or snake. So generally it should stick together, hold its form and be easy to pass, and generally most of the time be between type 3, 4 on the Bristol chart. If we go the other end of the scale, type 1 is more like those rabbit poops. Type 2 is really hard to pass and may, be lumpy, not a lot of volume. That tends to veer more towards constipation. And then the other end of the scale is when our stool starts to lose its shape and it may become quite loose, fall apart, maybe even stick to the toilet bowl. That's when we get into the realm of diarrhea or more loose stool. So most of the time, like I said, the goal is not 100% of the time to always have perfect digestion and no symptoms. It's going to be a little bit of variation depending on what goes on in your life, but most of the time, type 3, 4 on the Bristol's chart should be what we're aiming for. As I mentioned, that frequency, I like to see people moving their bowels at least every day, ideally 1 to 3 times a day. Generally should be brown in color. If there's any color changes, sometimes it can be a sign of maybe something going on with the liver. It could be something that you ate. Sometimes green foods, red foods can change the color of your stool. If you've ever eaten a lot of beets, you may have seen that reaction. So always good to bring that up with your doctor too, if maybe there's, a sudden color change, but most of the time it should be brown. And then ideally no undigested food, no straining, no pain, and a clean wipe on the toilet paper. It really shouldn't stick to the toilet bowl. If it's sticking to the toilet bowl, it may be a sign of fat malabsorption. So we really want things to flush clean most of the time. In terms of time spent, ideally keeping it to 5 minutes or less. You're in, you do your movement, and you come out. We don't really want to be sitting in the washroom for long periods of time, straining, waiting for things to come out. It should be a pretty short and efficient process. If you're needing to bring a book in every time, that may be a sign that, there's some work to be done on supporting motility and getting a better bowel routine. So let's talk a little bit more about bloating. Again, this is a common, thing we like to hear about. Oh, take this tea, do this supplement. This can help with bloating. Oh, I took this pill and my bloating reduced by 80% after 3 hours. So really, what is bloating? So essentially bloating is defined as like a feeling of a balloon in the abdominal tract. So sort of feels like there's air pushing on our abdominal wall and sort of an increase in the pressure there. And this is a bit different from abdominal distension, which is a visible notice in the girth of your abdomen. So there's actually a visible increase in its size, and that you would actually use like a tape measure. So bloating is a little more subjective, it's more like a feeling. Whereas distension, you can visibly see the change in the increase. So I see a lot of people with both bloating and distension, but it is possible to get bloating where you feel that sensation and it's uncomfortable, but you may not actually look visibly bloated. So it may not always go together, but they often do. As I mentioned, though, it is normal to have some normal bloating. So we want to keep this in mind. Not normal to have absolutely no bloating at all, but it is normal for our stomach to sort of fill with volume after we eat. and we may notice some distension or increase in abdominal width. It's, like I said, it's a sign that we're breaking down foods. Fiber goes into our GI tract, and then the bacteria there ferment it, producing gas. And, typically some bloating can come and go, relieved with some light movement or a bowel movement. And some bloating and distension is normal with eating and lets you know that essentially you're fueling your body. However, what is not normal bloating? So, not normal bloating is really painful, it's uncomfortable, maybe it's hard to the touch, and it's really persistent. So you feel like day in and day out, you're just getting this like really, a lot of pressure on your abdominal wall, and you're just feeling like it's hard to zip your pants up, and it just feels quite uncomfortable. And this is typically a sign of either, a condition like IBS. It can occur, does happen in IBD, and other GI conditions as well. And if it is happening, on a regular basis, maybe more than once or twice a month, then it is a sign that your gut needs some attention. So really the key takeaway here is that some bloating is normal, but not generally when it distracts from your quality of life and causes discomfort. That's what we consider not normal bloating. So I hope this sort of short episode really gave you some insight to start thinking about your gut health and what, are the indicators of good gut health, and some things to keep in mind like bloating and bowel routines, etc. So just to sort of set the stage for this podcast, and I want you to stay tuned for future episodes. We're going to go deeper into things that can help with bloating, that can help with our general gut health or our microbiome, or helping with motility, managing things like constipation and diarrhea. So I'm going to put some relevant links here below. If you have any questions about this episode, or any questions you want me to cover in future episodes, or any topics you'd like to see, definitely let me know. You can send me a DM over on Instagram at Leigh Merotto _RD, or you can post them in the podcast as well, wherever you're listening in from. So thanks everyone for joining me in this episode, and can't wait to talk soon. Bye for now. That's a wrap for today's episode. Thank you so much for listening and being a part of our community here. If the GutFit Revolution podcast is giving you value, helped your digestion and fitness, made you rethink how you approach your gut health, consider leaving a review on Apple, Spotify, or wherever you're getting your podcasts. If you have questions for our listener Q&A episodes, you can submit them as a comment on this podcast. For more digestible IBS gut health and fitness tips, memes, and personal stories from yours truly, be sure to follow me on Instagram at Leigh Merotto _RD. And for coaching, courses, and free resources, visit GutFitNutrition.com. Thanks for tuning in. We'll be in touch soon.